This is Dr. Paul, orthopedic doc with Easy Orthopedics, and today I'm going to talk about how to tell if your ACL is torn. If you like this video, we put out new content weekly, so please like and subscribe. So the ACL, the way I like to think of the ACL, at least I did during medical training, is it prevents the shin bone from moving anteriorly or to the front, right? So the ACL is holding your knee together, and there's obviously a lot of other ligaments, and preventing your shin bone from doing this, like moving front and back. So how do you know if you tore it? Well, if you're doing soccer, jiu-jitsu, or something like that, you won't always hear a pop, but sometimes you can hear a pop. It's usually pretty painful, and it's hard to walk on for a little bit. That is a sign that you might have torn it. Of course, there's other things that you could have damaged, but with an ACL, it's pop, swollen, and then sort of tough to walk on. Long term, you'll know you tore it because if you're walking or doing certain movements, if it feels like your knee almost wants to separate, then that's probably an ACL tear. That's not going to happen with meniscal tears. With MCL and LCL, that's not really quite how they present. A PCL tear can do it. The good things about PCL tears is they usually heal on their own if there's no other injuries. ACL tears don't. But yeah, if you feel like you had this pop at some point in time and the knee got all swollen and you kind of got back to activities, but it almost feels like the knee wants to give out, then there's a good chance you tore your ACL. The definitive way to tell is to get an MRI. That'll tell you whether you have it or you don't. I think that a lot of people know they tore it and they get the treatment, but there's a good chunk of people who tear their ACLs and never really know it. They just know, hey, I injured my knee like 20 years ago and it's felt a little funny since then. So there's certainly people walking around today that have ACL tears and don't even know it. But yeah, that's pretty much the course if you would tear your ACL. Pop, gets swollen, really painful, hard to walk on, starts to get better but doesn't quite feel stable, then chances are you tore it. Like the way you sort of tear it is like when your knee is sort of twisted inwards and you land on it and twist around. Obviously with jiu-jitsu and stuff, there's like heel hooks and leg locks and somebody could directly tear it for you. But most of the time, if it's not jiu-jitsu, you're going to be one that tears your own ACL. So I hope I was able to answer your questions about how to tell if your ACL might be torn. If you have any questions I didn't answer, feel free to leave them in the comments below and I'll do my best to respond. But I can't give you any specific medical advice over YouTube because this video and all my videos are for educational purposes only. Thanks for watching.